Awesome. Well, I am sitting down with Dr. Aaron Moorhouse. Thanks for meeting with me. Dr.
My
Moorhouse
pleasure.
has been in business practicing medicine for 25 years now. He owns his own family practice here in Meridian, Idaho. And then you've also had some other business ventures that you've been a part of. And the one that I'd like to highlight today is Legacy Medical Group, which I believe is a company you started in 2019. Is that correct?
Yes, that's correct.
So let me ask you, you still have a successful practice. So why did you decide to go from just doing family practice to also opening a new company and focusing on elderly patients too?
Yeah, so part of my practice here in Meridian over the years, my patients have grown older with me as well. Ones that I delivered as babies are now having babies, and so you grow older with your practice. And then I was invited to come into what's called a skilled nursing home or facility, which would be a nursing home of sorts over the years and take care of residents in those homes. And it's very difficult to take care of those residents. They have a lot of needs now. The way healthcare has changed over the years, sicker and sicker patients are being moved out of the hospital because it's super expensive to be in the hospital setting into skilled nursing settings. And then that forced skilled nursing to push them down into what we call assisted livings. And so you're getting higher levels of care in congregate living that we've never seen before. And I decided that there was a need to implement healthcare within those communities, and that would be advantageous for not only as a business model, but also for population health model and responsibility of taking care of the elderly in a time when there's a lot of expenditures in healthcare. And if I could prove that I would have better value and better outcomes by bringing healthcare to them in those facilities instead of them having to go to a facility or a doctor's office for that matter. And it's been quite the ride for us from the start, and we've shown a lot of potential and continue to grow. And now Legacy is reaching out in 7 different states now.
Wow, that's really good. So what exactly is the operation of Legacy itself? Is it just treating patients in these nursing homes? Is it the nursing home itself, the facility? What does Legacy do exactly?
So Legacy could be looked at as possibly what the terminology concierge medicine. We are bringing healthcare to these individuals in their home. And if you think about it, in an assisted living, and that's where Legacy spends most of its time is in the assisted living, not in the skilled nursing as much. We rather stay in the assisted living. If you bring the healthcare to them and you're seeing them more often, you are preventing more expenses within healthcare or further decline. An example would be emergency room visits. Before we brought in healthcare into these facilities or Legacy into these facilities, they would send their loved one or whoever, if they had a fall or whatever it may be, would be sent to the emergency room for an evaluation. The emergency room visit, on average, for an elderly person is around $6,000. Um, by implementing, bringing in a provider into those facilities and evaluating the residents there in their homes before they get sent out anywhere else, we've reduced those ER visits by about 75%. So if you can think of how much money we are saving the healthcare system, and also we're in there seeing these residents and monitoring them for a decline faster than they actually decline. Um, Everything tends to be reactive in medicine. If you fall, then we react to it. Well, if we're in the building and we're seeing that they're having difficulty walking, we try to intervene and see, all right, what's going on with that resident and try to prevent that from happening, that fall. And so That's the beauty of this plan, and of this business is we are bringing healthcare into these facilities, which they've never had before. They've always had to go take their loved ones or those people out to an office or a hospital setting to be seen, and now we're doing it inside their homes, basically.
Nice. So, so basically, in short, you guys are a network of providers who are actually visiting these patients in the assisted livings, not only providing care, but preventative care, trying to keep them happy and healthy longer. Is that right?
That's correct. So what I hire nurse practitioners. Nurse practitioners are what we consider a mid-level. They have education and the rights to prescribe medications and things of that nature. They are more cost effective in this setting versus having a physician. Physicians are just more expensive, and it's really hard to make it pencil because Medicare honestly pays 48% of what you bill. So that makes it really hard to make a profit or even break even for that matter. And so what we utilize is we take several nurse practitioners and then we use a physician to oversee those nurse practitioners and the care that they're giving. So a medical directorship, if you will, to oversee those mid-level providers in those buildings. And where the cost effectiveness is you're cost effective in prevention of ER visits and other costly issues, but you're also, how do you make a profit at that when the reimbursement's so low? Is because we don't have brick and mortar. You don't have to pay rent. And so that's what you're cutting out. You're cutting out a few different costs that are typically there in healthcare. Whether you have an office, you got to pay for your office, right? And staffing and all that good stuff. Well, I don't have an office. I don't have that rent that I have to pay. So that's how you can make this pencil and try to make it work. But also, on the other hand, is we're given good care and we're trying to be recognized by Medicare that we're actually preventing things. And Medicare will incentivize you to do good care and potentially pay you a higher reimbursement if you can prove that you are preventing those ER visits and things of that nature.
So that's interesting. So the course that I've taken in my MBA class this semester is New Value Creation, and the book it's about entrepreneurship and adding value to businesses. And one of the things that they highlight in the book is when you start a company is coming out with what he calls an MVP, the minimum viable product. And the whole idea is basically don't try to perfect the product or service before you take it to market. Take it to market, then get real valuable feedback from customers and make the changes as you're in business already. And so maybe for your instance, what did the minimum viable product, does that even relate to you? When you first started, was it just you going out and visiting these patients? Or did you already have an idea of, hey, we need to hire nurse practitioners to do this because doctors, it's too costly to survive off of Medicare reimbursements. Does that make sense?
Yeah, yeah, I would say that my experience of my own personal practice helped me develop what I would say is the minimal product or value, whatever you're trying to relate there, is my experience said, look, you can't even pencil this, so how can you do this? Uh, and that way, I started hiring nurse practitioners, and I put them in the building with the hypothesis is that I could pencil it. And then what's happened is over several years of doing this now, I'm collecting data, and the data that I'm collecting allows me to see where I can make improvements and where we are making a big difference within healthcare. And then that is allowing me to drive and make those adjustments now on how I go about things. I would have to say, typically, you take a nurse practitioner and then you got to say, okay, you got to have this many patients and you got to have this many visits every day to make this pencil. and cover their salary and the overhead costs and the billing and things of that nature. I would say that I I had a general idea of that, um, and then I put it into play and took that risk. And I think that's what any entrepreneur, if I were to give you any advice, is if you have a passion or a plan about something, to take that risk and jump in and then make the adjustments because you're not going to win everything. You're going to lose. And when you do lose, you learn from it and you make the adjustments to make it better and better outcomes. There's lots of key points that we've learned from this whole setup. For instance, one is to the people who own the assisted livings. By me coming in and adding just healthcare within those assisted livings, I'm extending the length of stay of their residents on an average of about 4 months. Now, that's not something that's reimbursable to me or anything, but if you look at if you're the owner of that facility, that is a huge income or revenue driver for you. And so they look at me and go, "Hey, we want you to come in. We had no idea it would do something like that." My idea was to give better health care and to prevent ER visits and things of that nature. But that was one example of a side effect that had actually benefited the owner of their own places, the facilities. And so I think to get back to what you're saying, the minimal thing I had was I just took a nurse practitioner because I knew that was cheaper than having a physician and that I could coach that nurse practitioner on how to see patients and take care of them and what our idea of good outcomes are. Um, then work from that on the data that we get on how much the billing is, what's coming in, what's it costing, and then controlling my costs from there. And so it took a little bit of money on my part up front, um, but it's worked out very well, and I continue to learn from this system and continue to push forward to expand. And it's been a real challenge, and I would say it's been really exciting in terms of growing a business, especially one that I have a lot of passion in, and one that rewards you with residents complimenting you and thanking you for what you're doing for them. I don't think it gets any better than that,
Yeah, I'd agree with
personally.
that. I'd agree with that. So it sounds like there's a few measurements that you guys, or a few things that you guys are keeping measurements of, and that would be reduced hospital visits, and then also,
Yeah.
as you said, length of stay
Yep.
for the owners of the facilities. Did you have that idea when you started the business, or is that something you found as you started to go? I mean, what were you guys measuring originally, as far as like key performance indicators go, so that you could actually measure success and growth?
Well, my personal experience with my own practice was is I was taking care of these individuals in some of these facilities, and every once in a while they'd get sent out to the hospital without them calling you, and it's something you could have taken care of and not wasted that money. And so I really have tried to develop my own practice in a way to prevent all those things. And on a healthcare level from a national level, we spend 21% of all GDP is spent on healthcare in the United States. And all we talk about is how expensive it's getting. And in my eye, I would love for us to take responsibility a little bit and be able to say, where can we help this out so our future generations have opportunity? Like Medicare is a program that gets threatened every year on the government level. And so I want to help preserve that for our children and things of that nature. So that's what really drove me to get in here and say, look, I've already done some of this, and you guys are making decisions on the government level without even looking on what's going on. And so I've tried to you know, influence that a little bit through my own experiences and provide. There's oftentimes you can go through life and do your job and not really have to say anything to anybody, and then you do your job and you're done. Um, But this is one of those things I feel passionate about, that there's a lot of people that could receive health care, and we can keep the costs in a better spot, and as a whole be responsible as a society. And so those key points that you're talking about, I knew that I could reduce ER visits just by being available and being able to get in there. And if you think about it, if I'm reducing it by 70%, say I'm reducing 10 ER visits a month, that's $6,000, and I saw them in their own place instead for $100. You can compute that. It's a win, and I can still make a profit at doing it, but yet have just as good or better outcomes as if they went to the ER. So that was one of the driving factors that I was doing at this. And then the other driving factor is the average age in these facilities is 83 years old. That's remarkable that they're that old. And what does the hospital have to offer an 83-year-old? Most of these residents do not want to be hooked up to a machine the rest of their life. Most of them do not want any type of life-saving measures that's extraordinary. They've lived their life, they're comfortable, and they have diseases that are not curable. They live with them. And so if it's just the education on taking care of them and making them comfortable instead of always trying to intervene and do things that are really costly that aren't going to really change any outcome, and that takes a lot of education on our part and with the families, and following the wishes of what that patient wants. Most of the time the patient wants one thing and their family is asking for another, and they only ask for it when it's in a time that is emergency, and we should be having those discussions way ahead of time. And so that's where I've really looked at the key things. Is one is better outcomes for the residents, taking care of them and allowing them to make their own decisions. And it's a satisfaction. Like your generation has the Yelp reviews and 4 stars and things like that about whether you go get a drink at Starbucks. How was that Starbucks? The same thing can be said about us as clinicians. Is Legacy providing a 5 star type of environment for them in their healthcare and their choices? And that's what I want to be able to do. I want them to be involved in their care and reassure them that our job isn't going to cure anything, but my job is to help them preserve their independence as long as we can and keep them in their homes. I don't want them to have to go to a higher level of care. For instance, in assisted living, the average cost is somewhere between 3 and 5 thousand a month in rent. If you go to a skilled nursing facility or long-term care facility, it's between 10 and 15 thousand a month. And then
Wow.
obviously, if you're in the hospital, it's more than that. So our goal should be to keep them in that lowest one for the rest of their life and bring the care to them there and not have to keep expending and go higher. Obviously, there's people with more needs than we can handle, and that's appropriate, but we're trying to prevent all that. And so I guess those are there's key points that you, or KPIs is how you say it in the entrepreneurial world,
Yeah.
that every time I meet with my staff and everything, it seems like another one comes up, and then we start trying to follow this data, and it's fascinating, it's fun and challenging, and I'm learning more key points all the time. And if you really want to look at one that I think is probably the most important, is the wishes of that patient. They want to stay in their home for the rest of their life. They don't want to go anywhere else. They don't want to go to a higher level of care. So if I set up a KPI and say, how many residents at this facility finish their life at this facility? That percentage is actually, it seems kind of weird to think of that, but if you get that, you won. You won the whole game. The patient got what they wanted, and you saved healthcare as a population on a population level. We saved a lot of money. We gave them what they wanted. We made them comfortable, and they finished their life out where they wanted to. Um, and
Awesome.
that KPI is really fascinating because it's not driven by anything other than the system doing what it's supposed to be doing.
Hmm.
Um, and I can give you an example of that. We have a memory care unit in Minot, North Dakota, that before we started Legacy, we looked up how many patients in that facility. And it was only a 30-bed facility. And memory care is people with dementia and Alzheimer's and all those kinds of things. So their life is not very enjoyable at that point. But we want to care for them and make them comfortable. And so before we started Legacy, 15% of all residents finished their life in that facility. Now, after Legacy, after we're in it for 6 years now, 98% finish their
Wow.
life in that facility. And so that goes to show that we're doing the right thing. The families want that for their loved ones. And to me, that's a huge KPI. It's better than any dollar value or anything like that. Is we followed the wishes of that family member and let them stay where they wanted to stay, or the families wanted them to stay there as well. So
That's incredible. That's a huge jump in percent. Um,
yeah, and that once again, Preston, that's one of those things that we didn't predict that. We didn't expect that. But we jumped in and we started this business and we started doing things. And then all of a sudden, we're seeing different numbers when we look at it and go, wow, we are making a difference. And what does that mean to us as a company? At first, we're sitting there looking at that number going, what does that really mean? Everybody's
mhm.
dying in our facility. And you look at that and you go, well, wait a minute. But if you look at length of stay, it lengthened and they finished their life with us. So that's a win, especially people that are 84 or older.
Yeah, yeah. No, home is home. I understand that completely. Well, I appreciate your time. I got just one last question for you, and that one is going to be based off of growth. Like you said, you started small. You had an idea, a hypothesis, and then you jumped in, and now you guys have grown into 6 different states, and I'm sure you're continuing to grow. So, as a business owner and as a doctor who's been focused on the patient, whose whole goal is to make people happier and healthier and enjoy the last years of their life, um, as you grow, how do you make sure that your company keeps the patient central to everything? Because once you get into this many states and you got this many employees working for you, how do you keep the culture focused on the patient and focused on keeping people happy?
Yeah, that is a really, really good question for most businesses if you think about it. If you grow too fast, how do you keep the quality? That's
Yep.
kind of how I'm taking that question. And
Hmm.
what's interesting is I have the attitude that I did medicine a certain way and as best I could, and I think myself this way. And your patients love you, so they want to see you, right? So how do you hire someone else to come in and do the same thing you're doing? It's really kind of hard. That is a hard thing in business, is to grow and keep the quality. And so what we do is we try to meet often. I actually meet with all of my providers, and now I have 30 providers. And so I meet with them often. I call it a PPI, a personal progress interview kind of a thing. And I'm constantly teaching, and I've really enjoyed that aspect of this is just teaching. And I will even go do rounds with them on occasion, um, and try to keep them to a point that uh, they feel comfortable doing what they're doing, and then I feel comfortable that we're still reaching the same standards. But there's always adjustments that are being made. I find that most of my new hires call me like every day and text me for about the first 6 months, and then all of a sudden it kind of dies off, and they've learned how to do it and do it the right way, and they get comfortable with what they're doing. And then I have to have really good staff behind them to support them that reports to me as well. I have had issues sometimes with providers, and I've had to let some providers go that it just didn't work out. It wasn't the kind of medicine they enjoyed, and they didn't fit this mold. So it's not for everybody, and um, you just gotta try to expose them. So anytime I hire someone now, I literally make them come spend a week with one of my providers and get exposed to it to make sure it's something they like because it's extremely challenging medicine. It's not the glamorous part of medicine by any means, but it is very rewarding if you look at what you're doing. But I think that's a challenge for all businesses that want growth, and you can grow so fast and get too big, and then the quality kind of goes off, and it's not consistent across the board. And so, I spend a lot of time striving to do that, and I think the way to do that is you have to be there. It's not something you can stand in your house and answer a few phone calls or even do Zoom meetings. You have to be on the ground and mingle with them and teach them and let them feel comfortable on bouncing anything off. And so I pride myself in being approachable by anybody that works for me can text me or reach out and call me, and I try to respond as soon as possible. And I think that is a key feature to this. And we're always trying to strive to have the best care we could possibly provide for these patients because everybody deserves that. All these people we take care of have lived lives that were challenging and struggling, and their bodies don't necessarily cooperate, and sometimes their minds don't cooperate, and they deserve to be taken care of and have every opportunity um, in this, especially in this country, to be able to have the access to care and and those things, and the education to what it is. So
Mhm. Well, awesome. That's pretty incredible. Um, it sounds like accountability, great training, and you got to find the right people. And I agree with that.
I
Not
would
everybody
I
can get
to go on your word right there, accountability. We all should be accountable.
Mhm.
And we don't know everything, and we should be able to listen and take learn from others, but be accountable for what we're doing and take responsibility. And that is huge. And if I could give any of that to any young people or entrepreneurs out there, that be accountable and jump in. And it's okay if you're wrong at times. That's okay. We only learn from the I only learned from the test questions I missed, unfortunately, but that's the truth of
Yeah,
it.
that is true. That is true. Well, thank you so much for your time. I appreciate it. I appreciate you sharing your experience in business, and I wish you the best of luck as you continue to provide care.
And good luck to you and your entrepreneurs. Thank you very much.
Thank you.